Hi everyone, welcome back to UWorld's Next Gen NCLEX Review. My name is Samantha and welcome back to another question drill. So today we're going to be covering the musculoskeletal system. We're talking muscles, we're talking bones. It will be our normal question drill setup. So we're going to ask 8 questions today. We'll read out the questions, read out the potential answer options, give you about 30 seconds to mull it over, drop your answers into the chat, and then we will reveal the answer and walk through that rationale. So a couple of things, housekeeping things before we get started. If you haven't followed us yet, go ahead and follow us at UWorld Nursing. Share this session if there are other nurses, nursing students that could potentially benefit from this. And make sure to comment in that chat, whether they're questions, comments, or of course answers to today's questions. We have the wonderful Nurse and Coley moderating, so stop by, say hi, and make sure you drop in your answers today. So with that being said, let's go ahead and get started. And if you guys want to warm that chat up by letting us know where everyone is joining from, we would love to see it. All right, so question number 1. Here the nurse is caring for assigned clients. The nurse should first assess the client who, option 1, has a femur fracture and altered mental status, 2, has a hip fracture and a discrepancy in leg length, 3, has osteomyelitis and reports pain rated as a scale of 9 on a scale of 0 to 10, or 4, had a lower leg amputation and reports paresthesia in the amputated foot. Drop those answers in the chat. Let us know what you are thinking. And I see a couple people answering our question of where everyone's joining from. I see some Ghana, some Uganda. Welcome. We are so happy to have you. It's always interesting to see who's joining stateside, who's an international viewer, regardless of where you are tuning in from. Welcome back to another question drill. Here. So also keep letting us know other topics that you want to see. In the next couple of weeks, we're hitting hard on some of those lesser known topics like teaching, legal and ethics, prioritization. This right here actually is a prioritization musculoskeletal question. So we're hitting those topics really hard. We get a lot of requests for them, but if there are other things that you want to see more resources on, see more of these question drills on, please drop it in the chat and let us know. Alrighty, someone else is joining us from India. Welcome, happy to have you. And I see lots of great answers in the chat. You guys are absolutely right. Option number 1 was our winner chicken dinner. So this is what we were looking for because it describes the manifestations and the risk factors of a fat embolism. This is a life-threatening condition and it is going to be our priority. Therefore, we should first assess this client. So there is a risk of a fat emboli formation following certain fractures, especially those of the long bones like the femur, for instance, or the pelvis can also cause this. So globules of fat that are stored in the bone leave and they travel through the bloodstream where they can go to the lungs, the skin, and the brain and cause damage by occluding those small vessels. So altered mental status occurs from when we block those blood vessels in the brain. We know that the femur fracture is a risk factor and the altered mental status is a manifestation of this fat emboli. So this is our first priority. Option 2, 3, and 4 are going to be expected findings, therefore they're not our priority. So if you have a hip fracture, we expect there to be a discrepancy in that side and that leg length. 3, osteomyelitis and reports pain as a scale of 9 on a scale of 0 to 10. This is going to be expected. Unfortunately, this is a very painful condition. We can treat pain later, but we have to tend to this emboli first and foremost. And lastly, the lower leg amputation with the paresthesia. This is reporting something called phantom limb pain, which is really common in these amputee clients. We can manage this later after we tend to the fat emboli client. Great job, you guys. Alrighty, question 2. Here the nurse is observing a staff member caring for a client that has compartment syndrome. Which of the following actions by the staff member would require the nurse to intervene? Select all that apply. Our options are to elevate the affected extremity above the level of the heart. 2 is assessing for a distal pulse in the affected extremity. 3 is preparing supplies for a fasciotomy of the affected extremity. 4 is placing cold compresses on the affected extremity. And 5, applying a compression bandage to the affected extremity. A lot of affected extremities there. Alrighty, so my favorite question to ask, let us know, drop your answers in the chat, and in the meantime, who here has recently passed their NCLEX? Let us know so we can congratulate you, and if anyone is scheduled to take it soon or is thinking about registering soon, let us know so we can wish you good luck. So any NCLEX passers, any NCLEX testers coming up, please let us know. We're always so excited to wish you guys good luck and to cheer you through the process. Alrighty, keep those answers coming. And I see Kung Fu Kenny just passed. Congratulations on TikTok. We're happy to have you and thank you for coming back and letting us know. Alrighty. Lots of great options. And remember, this requires the nurse to intervene. So we're looking for incorrect options. It looks like a couple of you may have gotten that switched and done it backwards. But when we're requiring the nurse to intervene, when it's a follow-up question or an intervention question, that means we're looking for incorrect actions, incorrect statements, or incorrect medications. All righty. Keep them coming with that in mind. We're looking for incorrect things. It means that our correct options today are going to be 1, 4, and 5. Because again, incorrect actions require intervention. So in this case, we're talking about compartment syndrome, which is a limb-threatening condition. It results from increased pressure in the extremity compartment. So it's typically due to edema after maybe a fracture or some kind of tissue trauma. And it can also be caused by too much external pressure. So maybe an overly restrictive bandage or cast. So the blood vessels and the nerves will become compressed, which is going to impair tissue perfusion and potentially cause nerve function injury. So signs of neurovascular compromise are going to be things like severe pain that's unrelieved by medications. That's a really big one. I want you guys to highlight that for NCLEX questions. If you see severe pain that's really not helped by some higher level narcotics, it's going to be a big sign and a red flag should go off in your head that this could be compartment syndrome. Other manifestations include prolonged capillary refill time, as well as a general coolness over the affected extremity, and these occur due to that tissue ischemia. So if left untreated, this can lead to the loss of limb function, the paralysis, tissue necrosis, and eventually even loss of that limb. So when we're caring for these clients with compartment syndrome, we want to make sure that we position the affected extremity at the level of the heart because we want to maintain that perfusion. We don't want to put it above the level of the heart, which is why option 1 was incorrect and we have to intervene on it. Same thing, we want to avoid cold application as an option number 4 because this further vasoconstricts, which is going to decrease the blood flow, and we're trying to restore and maintain perfusion. Option 5, also incorrect. Compartment syndrome can be caused by overly restrictive compression bandages. We're trying to avoid direct pressure and relieve that pressure. So in this case, this can further limit blood flow. So it would also be an incorrect action. So 1, 4, and 5 are incorrect. 2 and 3 are correct actions, therefore they don't require follow-up. We want to make sure we're frequently assessing these distal pulses to check for distal tissue perfusion and monitor for any continued lack of blood flow. And fasciotomy would be a procedure, it would be a provider-performed procedure, but it is something that's done to relieve the pressure that we see in compartment syndrome. It utilizes surgical incision to relieve that pressure within the compartment, and it should be anticipated for these clients with compartment syndrome. So even though the provider performs it, the nurse would be doing the right thing by gathering supplies and preparing for it. So again, correct options are 1, 4, and 5. Great job. All right, the nurse is caring for a client who is in balanced suspension skeletal traction. Which of the following actions should the nurse take? Should they place the client in a side-lying position? Should they maintain the head of the bed at greater than 30 degrees? Should they remove the weights briefly every 2 to 4 hours? Or allow the weights to hang freely off the edge of the bed? I never liked traction, any kind of suspension questions when I was in nursing school. These always were tricky for me. So no worries if you struggle with them, we'll go through it in full. But with that being said, you guys are definitely not struggling with it in the chat. So no worries, you must have been much smarter than me. And if you haven't already, make sure to check out uworldnursing.com. It's a really great home base for all of our social media efforts. It gives you the times, the topics, and the channels that we plan to go live. It gives you links to buy our product, to access our 7-day free trial, and to pertinent blog posts that give you really great information about the NCLEX as a whole, as well as the UWorld products. So check out uworldnursing.com. I can't sing its praises enough. All right, great answers. I see 100% correct answers, so great job, you guys. You are crushing this. Our correct option was option number 4. So skeletal traction involves surgically inserting screws, wires, and potentially pins directly into that fractured bone and applying a pulling force, which is the traction, with a pulley system and a rope. So the pulley system allows the weights to suspend from the foot of the client's bed and applying a pulling force on the skeletal pins to maintain the alignment of that fractured bone, which is the point of what we're doing with this traction. So the weights must hang freely at all times to provide that necessary pulling force or that traction that this client needs. So option 4 would be indicated in this case. Option 1, 2, and 3 would be incorrect. So place the client in a sideline position. We would want them flat on their back. We want them supine. And this is kind of the same teaching point in option 2. If they're flat on their back, we don't want to maintain the head of the bed at greater than 30 degrees. That's going to keep them slightly up in a semi-Fowler position. This is not indicated. And same thing, removing the weights briefly every 2 to 4 hours. This traction is continuous. We're not going to relieve it every as frequently as this says. So option 4 was our correct option. Way to go, you guys. All right, halfway mark. Question number 4. The nurse is teaching a client with osteoporosis who is receiving alendronate. Which of the following information should the nurse include? Should they ensure you take the medication with food? Lie down for 30 minutes after taking the medication? Drink an 8-ounce glass of water with the medication? Or 4, take your other morning medications with alendronate? Drop those answers in the chat. And another bragging point about uworldnursing.com is now we have a question of the week feature. So if any of you guys are familiar with our social media, which I would assume you are if you're joining us on social media right now, you see that we put out a question of the day every single day that covers different topics based on each week. We also have another free resource, a question of the week. Go to uworldnursing.com to register for it, but it sends a UWorld NCLEX style question straight to your email inbox every single week, as well as a full rationale. So another great option, a great resource, and most importantly, a free resource. So make sure you guys take advantage of it by going to uworldnursing.com. All right, and I see almost on option 3, you guys are absolutely doing phenomenal today. Totally right. So in this case, alendronate is a biphosphonate medication that's commonly used to treat osteoporosis and decrease that risk of osteoporosis-related bone fractures. That's a mouthful. So biphosphonates work to inhibit osteoclasts, which are cells that cause bone breakdown, which allows bone building to occur more quickly. Biphosphonates need to be taken on an empty stomach. So ideally 30 minutes before you eat or 2 hours after you eat to ensure optimal absorption. When we administer them, we do it with a full glass of water, which is option number 3. Way to go, you guys got that. We want to remain upright for 30 to 60 minutes to maintain that complete passage of the medication into the stomach and reduce the risk for reflux up back into the esophagus, that acid reflux. So in this case, option 3 was our correct option, and we addressed there why 1, 2, and 4 were incorrect. So great job, you guys. Question 5, the nurse is teaching a client with gout about low purine foods. Which of the following foods should the nurse include? Select all that apply. So we're looking for our low purine foods. Is it aged cheese, canned tuna, smoked turkey, yogurt, or avocado? We are in Texas and it is just about lunchtime here, so this question makes me hungry. But again, diet questions can be tricky. There's all different diets depending on the affliction that the client is suffering from. But in this case, the client has gout, so we're looking for those low purine foods. Let us know what those are. And also keep letting us know, how do you guys like to study? Are you using a QBank? Are you using a workbook, an in-person review? I know there's a lot going on right now about in-person reviews, 3-day reviews. So let us know how you're studying, how you like to study, what works best for you. Maybe it's flashcards, note cards, any kind of self-assessments, videos. It's always interesting to see the new ways that people come up with to study for the NCLEX. I see a workbook from Emma. That's a great way to study. Alrighty. Someone asked about SATA questions and the grading. I think what you're asking about is partial credit, and you are awarded partial credit on the Next Gen NCLEX, which was instituted in April of 2023. So you do get partial credit. You are awarded for your correct options, but you are not docked or having negative points for incorrect options. You just don't earn the full amount. But again, partial credit is given. So if there's 3 correct options on a SATA question or a select all that apply, and I only get 2 of them, I get the points and the partial credit for those 2, but it's not the case that it used to be, which if you didn't select all of the correct options, that they mark the whole question as a whole as wrong. All right, and someone else passed their NCLEX, so congratulations. All right, lots of great answers coming in, and I see a mix here. It looks like most of you guys got the kind of meat of what we were looking for. But in this case, we were not looking for meat because gout is an inflammatory condition caused by the ineffective metabolism of purines. So this results in the accumulation of uric acid in the blood, which is called hyperuricemia. As these uric acid levels rise, crystals form in the synovial fluid of the joints, which results in that pain and the warmth and the redness and swelling of the joint. It's really painful. It can also present with fever, and eventually, after a little bit of time, tophi can form, which are the visible nodules of uric acid crystals that develop in the soft tissues surrounding the joint. So to avoid this, we keep these clients on a low purine diet. We're going to make sure we're getting plenty of that low-fat dairy, so milk, yogurt, cottage cheese, avocado, nuts, legumes, fresh fruits, and vegetables. This includes yogurt and avocado. 4 and 5 were our correct options. 1, 2, and 3 are actually high purine foods, so we're avoiding the aged cheese, that canned tuna, smoked turkey. A lot of these are also pretty high in sodium. So 4 and 5 were our correct options. Way to go, guys. All right, question 6. The nurse is observing staff members caring for assigned clients. The nurse should intervene if a staff member is observed. Option 1 is encouraging a client who had an above-the-knee amputation 6 hours ago to lie in the prone position for 30 minutes. 2 is assisting a client who had a below-the-knee amputation 12 hours ago to move from the chair to the bed after sitting for 45 minutes. 3 is placing a pillow under the residual limb of the client who had an above-the-knee amputation 2 hours ago. Or 4, teaching a client who had a below-the-knee amputation 24 hours ago how to perform active and passive ranges of motion. All righty. Someone just took their NCLEX. Congratulations. Way to go. Someone asked more on the SATA partial credit. If you check them all, do you get full credit still? Yes. So if you still get it all correct, you get 100%. It's just saying that if you miss one of the 3 maybe correct options for a question, you're not totally marked completely wrong. You still get partial credits for the 1 or 2 that you did select correctly. Alrighty, and kind of a split here in answers. I see 1s and I see 3s. Alrighty. Someone asked why no aged cheese? Because it is a high purine food and we are avoiding purines in our gout clients. That's a great question. We do not have a discount code, but we do have a 7-day free trial, so make sure you check that out. uworldnursing.com is where you can find it. Alrighty, great job, you guys. I see almost all 3s in 1, so a little bit split, but in this case, option 3 was our correct option. So following a lower extremity amputation, whether it's above the knee or below the knee, an important component of rehabbing this is preventing contractures. So prolonged hip flexion will cause the tightening of the muscle fibers, which can restrict the joint motion and lead to pain and potentially in the future an unsuccessful prosthesis placement. So in this case, to prevent those hip flexion contractures post-amputation, clients should avoid prolonged flexion of the residual individual limb or the hips. So like elevating it on a pillow, sitting in a chair where the legs are elevated a little bit for greater than 1 hour. That's going to increase the risk of these contractures. So option number 3 requires intervention because that increases our risk of contracture. 1, 2, and 3 do not require follow-up. So encouraging this client in option 1 to lay prone. Prone is a great position for flexing the hip muscles and preventing those contractures from developing. 2, and remember, prone is when you're lying on your stomach. 2, assisting a client with a below the knee amputation to move from the chair to the bed. This is appropriate. It's flexion contracture prevention. And also note they're only sitting here for 45 minutes. It's not greater than the 1 hour that I previously specified. Lastly, 4, teaching the client about how to perform the active and passive range of motion exercises. This is a great thing. Muscle strength and mobility are great tools to prevent these contractures from forming. So again, option number 3 was our correct option because it requires intervention. Alrighty, the nurse is teaching a client with osteoarthritis who is reporting pain and swelling of the right knee. Which of the following information should the nurse include? Select all that apply. So avoid splinting your right knee. Perform weight-bearing aerobic exercises regularly. 3 is apply heat and cold therapy to your right knee as needed. 4 is place a pillow under your right knee while you are sleeping. And 5 is take prescribed or over-the-counter NSAIDs to manage your pain. Alrighty, let us know. Right, and someone's asking for the link. I think it's uworldnursing.com is what you're referring to. That's just uworldnursing.com. I think someone put it in the chat. Go ahead and copy it over. I don't think that in the comments or the chat we're able to put clickable links, so you'll have to either select it, copy and paste, or you'll have to just type it into your toolbar. Alrighty, and if you guys are not aware, UWorld is partnered with the NSNA, or the National Student Nurses Association. We are so excited about this partnership, and through them we're doing a lot of really exciting things throughout the year. We had a huge presence at their April convention in Seattle. If you were there and you said hi to us, let us know in the chat. We had so much fun meeting you all. We're also going to be having that same large presence in Columbus, Ohio. I think instead of the 3 days of speaking, we're doing 2 days this year. We're so excited to be in Columbus in November. And if you're not able to join us in person at any of these conferences, we also offer NSNA webinars. There's 6 a year. Our next one is going to be Monday, September the 8th at 11 to 1 Central Time. So we're really excited for that, lunchtime little break. Maybe you can duck out of a class or a clinical or in between your study schedule and join us. But again, Monday, September 8th, and that is our 5th webinar of the year, if you can believe it. So after that one, we'll just have one more in October. But these have been so much fun to do. We've gotten a lot of great people joining and participating and chatting, and it's been an absolute joy. Alrighty, so great options, great answers, you guys. I see a lot of, lots of 2s mixed in here. It looks like this one may require a little bit more time to go over, but osteoarthritis I think can be tricky, especially because osteoarthritis and rheumatoid arthritis, a lot of people kind of lump them together, but in reality they're pretty different. So in this case, it is going to be osteoarthritis. So our correct options are 3 and 5. So osteoarthritis, we'll call it OA for short, is a condition of the synovial joint. So it affects the knees, the hips, and the fingers can be some of the things that have the most pain from OA. So it causes the progressive erosion of the articular cartilage and the bones that lie beneath it. So as the erosive process continues, bone spurs, or osteophytes as they're called, and calcifications will develop in that joint space, and the cushion between the bone ends breaks down. So it gets to be bone on bone. This causes pain, deformity, and it can cause joint instability. So what is indicated, and again, this question is looking for correct information, is RICE, which stands for rest, ice, cold and heat, and elevation, as option number 3 describes, as well as NSAIDs to help reduce some of that inflammation that OA will cause. So 3 and 5 are our correct statements. Therefore, there are correct options. 1, 2, and 4 are incorrect. We would not want to include this. We do want to splint the knee to help to stabilize it. Again, this can cause joint instability, so this splint will add in a little bit more stability. Performing these exercises, weight-bearing aerobic aerobic activities regularly, if they're having this pain and swelling of the right knee, they're clearly having a flare-up or an exacerbation. And in this case, we would want to rest to help this swelling go down and to help with the pain as well. And option 4, placing a pillow under the right knee. In all reality, we want to put a pillow under the feet to help allow some of that swelling to gradually go down, not underneath the affected knee, so under the feet. Again, option 3 and 5 were correct. Someone asked, why not 2? This client has osteoarthritis, and while in other times we may want to encourage them to do, movements and make sure we're keeping the blood flow there, they're having a flare-up right now because they're reporting pain and swelling of the right knee. So it's kind of a change from baseline. In that case, we're going to want to rest and allow some of this swelling to go down. We're not going to want to have them do weight-bearing aerobic activities. That's going to be pretty painful for them, and it's not going to encourage rest. Alrighty, question number 8, our last one of the day. Someone again asked what RICE stands for: rest, ice, compression cold/heat, and elevation. All right, so question number 8 is the nurse is teaching clients at a community health fair about the prevention of back pain. Which of the following information should the nurse include? Should they lift heavy boxes using the arms? Avoid body movements that twist your spine? Pull rather than push when you are moving objects? Or lastly, lock your knees when standing for extended periods of time? Drop those answers in the chat, and after we're done today too, let us know how many questions out of 8 you all got correct. Let us know if anyone went 6 for 8, 7 for 8, maybe a full perfect 8 for 8. Regardless of what you got, we are so glad that you joined. We're all here to learn and to make progress. So thank you so much for tuning in. And so you guys know, if you want more information on our schedule, we go live 7 times a week on 5 different days. So we are doubled up on some days, but we're live noon on Tuesdays with a lecture. Yesterday we covered COPD. We're back today with a question drill. We're here at 11, back at 7 p.m. with Nurse Andrew. These are all in Central Time, by the way. Tomorrow we're back at 11 a.m. and 3 p.m. And Friday we're back at 7 p.m. and Sunday at 7 p.m. So these are all going to be live on TikTok. If you didn't catch that, uworldnursing.com has our complete list of times, topics, and channels that we go live on. So I'm not going to say it again, but you can go to uworldnursing.com. Alrighty. So it looks like we have lots of answers coming through, and I see 2s and 4s, but mostly 2s, which is good news because that was our correct option. So we're looking for information that should be included, therefore we're looking for correct information. It is correct to avoid body movements that twist your spine, which would contribute to back pain. We always want to be square. When you're lifting things, we really don't want to twist and have any of that torque or torsion. 1, 3, and 4 are incorrect. So lift heavy boxes using your arms. We want to lift with your legs and stabilize your core to help. This will help prevent back injury. Same thing, 3, pull rather than push. Pushing is going to be easier than pulling something towards you when you're moving objects. And if you can make it easier, that's going to be more likely to prevent that back pain. Again, 4, also incorrect. Lock your knees when standing for extended periods of time. You want to keep soft knees, keep a little bend. You don't want to have them locked. So 1, 3, and 4 were incorrect statements, whereas 2 was our correct statement and our correct option. So great job, you guys. Alrighty, thank you so much for joining. We're going to be back with Nurse Andrew at 7 p.m. Central Time tonight. So make sure you tune into that. Check out uworldnursing.com, and thank you so much for joining.